Where did COVID-19 first emerge? First case of the coronavirus pandemic or COVID-19. On December 31, 2019, the WHO China Country Office was informed of cases of pneumonia of unknown etiology detected in Wuhan City, Hubei Province of China. The outbreak began in a seafood and poultry market in Wuhan, a city of 11 million in central China. Like SARS-CoV and MERS-CoV, the newly detected coronavirus, or SARS-CoV-2, has a zoonotic source. However, human-to-human transmission has been confirmed. On March 11, 2020, the WHO declared COVID-19 viral disease a pandemic. What should we do to prevent the spread of COVID-19? First, know yourself. And how do you know? The group that most spreads the COVID-19 virus is in the age range of 20 until 40 years old. High-risk people getting COVID-19 is first, have obesity or overweight with BMI above 27 kg. Second, having a low body resistance or immunity. Third, comorbid disease or hypertension, diabetes, cardiovascular, heart disease, asthma, cancer, and kidney failure. And the last is old age. Age 60 years and over. Second, know your enemy. The SARS-CoV-2 virus or coronavirus attacks the human respiratory system and causes mild to severe disturbances, even death. The disease caused by this virus is called COVID-19. COVID-19 can affect anyone, with exceptions, including young people. COVID-19 is not transmitted by animals, but is transmitted between people, especially from close people. COVID-19 is transmitted through droplets that a person releases from the mouth or nose when sneezing, coughing, even when speaking. Droplets can fall and stick to objects around us. Therefore, when we hold these objects, our hands have the potential to become a transmission route for COVID-19 if they touch the nose, mouth, and eyes. The weakness of the virus are, first, may die if the living area is cleaned with soap. Second, the virus is resistant to high temperatures, but the higher the temperature, the shorter the survival period of the virus. And three, know your battlefield. We must also be aware of high-risk places of transmission of COVID-19, namely locations that have the potential for crowds and high social contacts, such as markets, schools, buildings, and others.
You feel not healthy. First, if you feel unwell by the criteria 3 kind, namely A. A fever of 30-18 degrees Celsius. B. Sore throat and fatigue. C. Cough and cold. How can we win against COVID-19? Win against COVID-19, let's do this by wearing a mask, keeping a distancing from crowd, washing hands with soap, and always providing hand sanitizer. Wear the mask. 1. Protect yourself. Masks prevent the entry of droplets that come out when we cough or sneeze or talk, so don't catch them. 2. Protecting others. Masks hold the droplet that come out when we cough or sneeze or talk so they don't transmit the virus to others. Keep distance and avoid crowd. Why keeping distance is important? The droplets that come out when we cough with a mask can slide up to 2 meters. When talking without a mask, aerosols, water vapor can slide as far as 2 meters. When sneezing without a mask, the droplet can slide as far as 6 meters. By maintaining a distance, we can reduce the risk of contracting spreading it. Important things that can be done in an effort to maintain distance are as follows. Avoid crowd. Avoid using transportation that does not meet standard health protocol, and reduce activity in closed or conditioned space for more than 2 hours. Washing your hands with soap important. The virus deals with soap and running water. Perform the 6 steps to wash your hands properly, namely washing your hands with soap and running water for at least 20 seconds, or washing your hands with a hand sanitizer with an alcohol content of at least 60%. Do you know COVID-19 is a small material wrapped in protein and fat? Soap can dissolve it so that the virus is destroyed and dies. What if there is no soap and water? Can use hand sanitizer. When wash your hands frequently, especially before touching your eyes, nose and mouth. 6 steps for washing hands with soap. WHO. 1. Evenly distribute soap with both hands. 2. Rub the back of your hand and between your fingers alternately. 3. Rub the inner finger. 4. Rub your palms with your finger hooked together. 5. Rub the thumb in a circular motion in the grip and do it on both hands. 6. Rub fingertips on the palms in a circle and do it on both hands.